So cancer is a disease of the body where part of the body decides to grow continuously without stopping and can then spread, and it can happen in any part. So according to Cancer Research UK, there are approximately 250,000 people each year who develop cancer, with a roughly 50-50 split between men and women. It's primarily a disease of later life. It can happen to anyone at any point, but you are much more likely to develop it the older that you get. There's no one thing that causes cancer, but there are lots of things that can contribute. We can be built slightly incorrectly and have inherited problems from mum and dad, or there can be a strong family history of cancer, which can mean we are more likely to develop it in later life. And then the rest of the reasons are usually due to exposure, and that can be things we've eaten or drunk, alcohol, smoking. It can be due to lifestyle and where we work. So coal miners is one example, people exposed to dusts, and clearly also being overweight and being obese has an impact. So whilst there's lots of potential symptoms of cancer, two things really stand out, and that is if someone has bleeding from somewhere that they would not expect to have bleeding from, and that can often be a sign of cancer. And the other thing is a bit more general, but if someone has a problem or a symptom that is persistent, stays there longer than they would have expected, doesn't really settle, and in fact when they look back has slowly gotten worse over time, those are the two things that really stand out as a warning sign for cancer. Well, I think the first thing to say is to remember that cancer is still relatively rare, and you are much more likely to have something, for want of a normal word, normal going on. So it could be a cough or a cold. But if you are concerned, then have a word with your GP and raise your concerns, and you can work out a plan between you for what to do. There's a whole host of things that someone can do to contribute to living more healthily and therefore be less likely to develop cancer. I suppose the first thing you could say is to be more conscious and more aware of one's own history and where one's come from and one's own story. Are there relatives or family members who have a cancer, and might that impact on them? And then there's all the things that we know we should do and perhaps could do better, such as losing weight, leading a healthier diet, avoiding too much sugar and carbohydrate in the diet, avoiding alcohol or having a very limited amount, certainly avoiding cigarettes, and trying to do regular exercise. There's also a bit of evidence that if one's married and in a long-term relationship, that's better for us in the long term than being alone.